Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to this special edition of the Gastro Girl podcast. This is special for two reasons. One, we have our amazing guest and partner in GI psychology, Dr. Ali Navidi, who we are so proud to work with. We're offering an exciting summer workshop, and he's here to tell you all about it. And we're going to talk about it today. Welcome, Dr. Navidi. So great to see you.
Yeah, Jackie, I'm super happy to be here. And I always love talking with you. And I think this is a great platform to get some really good information out there to the people that need it.
Now, first of all, before we talk about the workshops, for those listeners who may not be familiar, there's a term that we're hearing more and more called GI psychology, which also happens to be the name of your practice group, GI Psychology, which is based in Virginia. But you also work virtually with patients all across the country for the most part, you and your team. So let's just give a little overview of what GI psychology is and how it may apply to someone who's living with IBS, IBD, or another digestive health condition.
That's a great question. So let me even back it up a little further and kind of introduce myself too. So I'm a clinical psychologist, and I've had, for 13 years, I've had a practice in the DC metro area. And it's been an extremely specific and focused practice. I've worked with patients primarily with GI disorders and chronic pain. And because of that specialty, I've worked with a lot of people that have complex medical conditions. And over the years, because there are so few what are called gut-brain therapists out there, that, I've just kind of been overwhelmed by all the gastroenterologists and different people sending these patients with IBS and functional dyspepsia and these other GI disorders. That about 4 years ago, myself and another psychologist, Dr. Duffing, started the practice called GI Psychology. And so that practice, and it's at that website, so it's gipsychology.com. And the mission of this practice was we want to increase access to care, because what we found is that there are these amazing treatments that have tremendous research behind them. We've got millions of patients with these problems, and there's 500 gut-brain therapists at most in the world. And so GI psychology is trying to change that, to train more people and to make this treatment more available to the people that need it.
No, this is great. And I'm glad you gave an overview, because I take it for granted. I know what you do, but our listeners don't. So thank you for that. May not know. Some may know. But yeah, if you will, what kind of therapies, you talked a little bit about gut-brain therapies, what can a patient or a individual expect? What do you do?
So there's two major modalities or types of therapy that we use. And we use these two because they're just so solidly backed up by the research. And the first is gut-focused cognitive behavioral therapy. And I say gut-focused to differentiate it from just kind of generic CBT. Generic CBT, if you don't know, is an amazing type of treatment. It's helpful for anxiety and depression and a bunch of other problems. But generic CBT is not particularly helpful for someone with GI problems. Now, there are versions and specific protocols of CBT that have been developed that can help people with GI problems. And there's a lot of research showing that they're effective. So that's the one side of it that we do. The other side is gut-focused clinical hypnosis. And clinical hypnosis, sadly, has such a bad name because it's been mixed up with all this entertainment stuff. But when you kind of strip it of all the magic and witchcraft and mind control and other foolishness, what you find is you've got this form of treatment that has over 30 years, they've been studying it. And for 30 years, it's been shown to be effective. And you can see that because it's in the guidelines for the American College of Gastroenterology. gut focused CBT, gut focused clinical hypnosis. They're built into the guidelines because there's so much research. It's recommended treatment for patients with IBS and similar disorders.
So can, hypnosis, that's almost like a real relaxed state where you're just relaxed, right? Like when we think of hypnosis, like, yeah, we think of like those cartoonish at
Yeah.
like bars where they, I've done that and I'm walking around like a chicken or something, but that's
Yeah.
not really it. It's like I would just imagine if you take that mentality, like you're so relaxed that you're able to not have all that, the noise. So
Yeah.
you're able to focus on the area that needs the most attention. That for this person like IBS is the brain gut connection. Is that?
Yeah.
Yeah.
I think the place to start often is like, look, people should be skeptical of hypnosis. If I had never heard anything about it other than TV, stage shows, and other stuff like that, I would absolutely be super skeptical about this thing. I think that's normal for people to just hear that word and be like, I don't know about that. But so what actually is it? If it's not all that, what actually is it? It's just a way of teaching someone how to go into a state of trance. And trance is a normal human state of consciousness. We all go in and out of trance. I went for my workout this morning and, I drive to the gym. I'm totally in my little driving trance, right? Like I'm thinking about this, I'm thinking about that. I'm not thinking about driving, but it's getting done, right? And then suddenly I'm there. And people who run, the runners often go into this runner's trance. Like if you just work on the computer and you get really into what you're doing, you go into a trance because when you're done working, you're like, oh man, and your back is tight, but you weren't feeling any of that while you were in that working trance. So trance is a very normal state of consciousness that we're all doing it. And hypnosis is just about teaching people how to do it on purpose. And then why would we want to go into trance? Well, it turns out, like you were saying, Jackie, that when we're in trance, all that noise and all that like distraction kind of like fade away. And we're able to just focus intensely on that brain gut connection. And that's a whole other subject of discussion is, in case people don't know, the brain and the gut have an amazingly close connection with each other. So much so that it's a whole field of study for science. They call it the brain gut axis. And there's papers being written about it constantly. People are researching this. So what we need to understand is pretty simple, which is what happens in the brain affects the gut, and what happens in the gut can affect the brain. And so it's this bi-directional thing that's happening. And it turns out that when we're in trance, that focused attention can really do some good things for the gut.
No, I'm so fascinated by this area. I have been for a number of years, and it's so great to see attention on this and professionals like yourself who are really focused on taking all the years of research and understanding and being able to bring it to patients. This is fantastic. And I wanted to also highlight the fact that you and your team also work virtually, and that this type of therapy can be done virtually. Like we could have a session right now.
Yeah.
And I could be, coached or guided into that trance so that I'm able to reap the benefits of that gut directed hypnotherapy. And there have been papers on that. We've seen that as being effective.
Oh, yeah. Yeah, absolutely. So, before the pandemic, I hadn't really done much video therapy at all, but probably like most therapists out there. But we had to figure it out, right? And what we figured out is that with some pretty small modifications, it's just as effective. And then people have gone on to study that and found that to be the case, that things work pretty much just as well as they do in person. Obviously, in person is always going to be better, like, that physical presence, but we're talking about like 99.9% of the benefit you're going to get from telehealth. So the practice is telehealth. We're in all 50 states. And we worked hard to do that because, again, our mission is to make this treatment available to people. We're tired of seeing people being bounced around the medical system for years, Jackie, getting, the wrong types of treatment, because nobody out there is trained to give them the treatment that can help. And what I mean, it can help, I mean, these are short-term treatments that are highly effective. So we're talking about on average 10 sessions, and we get about an 80% effectiveness rate. If you're familiar with any kind of like the medical research, 80%
It's huge.
Treatment goals is huge. Yeah.
No, it's unbelievable. But it's amazing because my heart breaks when I get emails and notes from patients about their journeys of years and years. And we've done episodes on this with, just recently with Karen, her journey on IBS-C. I mean,
yeah,
unreal what patients have to go through. My own situation with IBS and trying to what's going on? Why did I have all these problems and no one ever, you just think you deal with it. I mean, it's absolutely incredible that we're able to have this conversation today and educate patients that there are options that are very effective through addressing what's going on between that gut-brain intersection.
Yeah.
And tools. And you're not saying they have to be doing this for life, but you give them tools, right, to be able to manage this in a way that is maybe not treatable by a medicine or a diet. It could be part of a multidisciplinary approach.
Yeah.
But this is, I feel very honored to be here today, revealing what we're going to reveal for our patients that may be interested. So can you explain, hopefully we covered everything, we kind of laid the groundwork for what we're going to talk about next. So we're in partnership with Gastro Girl and GI Psychology, being the experts who are delivering this. We are so proud to offer 4-week workshops, and we're enrolling this summer. Who should benefit? Who should be paying attention to this right now?
Yeah. So GI Psychology, probably for the most part, we spend a lot of time doing individual work, right? But we realize that sometimes people are skeptical. Sometimes people just need an easier way to kind of get that first taste of what we could really do with our mind-gut connection. So we wanted something that was less expensive. We wanted something that was more available, that we could do in a group setting. And so it's short term. It's 4 weeks, talking about an hour session. And it's what we did was we kind of combed through and found, this mix of, okay, what are the 4 core ideas that we want patients to understand intellectually? And those are built in. One of those really important ideas is built into each session. And at the same time, we don't want it to just be intellectual. So what are if you had to just pick 4 techniques, 4 methods, 4 tools to teach patients, what would they be? And those are the exercises that we picked, 1 for each of the sessions. So you get this mix of these really important, powerful ideas mixed with an experiential exercise, so that you can take what you're learning intellectually and you can apply it to doing some good to the brain-gut axis.
So each of the 4 weeks is going to be focused on a particular area, a particular exercise or learning.
Yeah, there's going to be a learning and an exercise for each week. Yeah. So you get this mix in each session.
So my next question is, who would benefit from this? If our listeners are out there, is it a particular, do they have to have IBS, IBD? Who would benefit from this?
Yeah. So we wanted to make it broad enough that the people that would benefit would be anyone with a DGBI, so a disorder of gut-brain interaction. That would include IBS, functional dyspepsia, functional abdominal pain. There's I think maybe 30 something different disorders that fall under that category. But the category is one where okay, there's no structural problem here. There's no inflammation. There's no ulcers. It's how the brain and the gut are communicating with each other. And just as an example of how massive this problem is, just patients with IBS, that's going to be about 45 million, I think.
Yeah.
Yeah, like 1 in 10 in the United States. And that's just one of these disorders of gut-brain interaction. And so those patients absolutely can get some benefit, as well as patients with IBD. Frequently, you see patients with IBD, so that's Crohn's or colitis. They've also got GI discomfort, GI pain. There's often an overlap where they have maybe IBS and IBD. So I think they can benefit also. But in general, if you've got one of these GI disorders, and you're just curious, you're like, I don't know if I want to commit to this one-on-one therapy just yet, but I want to learn more. I want to see what I can get out of this. You will not be wasting your time, and you will be getting some practical tools that you can begin immediately to make your symptoms better.
So we often hear, I'm going to bring this up because we hear a lot about post-traumatic stress disorder and also its role in some of these GI conditions like IBS or even IBD. What are your thoughts on patients who may have PTSD, but they don't realize or they haven't been diagnosed with IBS yet?
Yeah. So that brings up a broader question of these disorders of gut-brain interaction. Who tends to get them more often? And so you can look at different categories, right? So one of those categories are patients with anxiety disorders, right? So if you have an anxiety disorder, there is an elevated chance that you also have a DGBI also. You might have chronic stomach pain or chronic nausea or bloating or different things like that. And honestly, if you have these symptoms, but you haven't been checked out, go get checked out right now because you might be a great candidate for this type of treatment. So patients with anxiety disorders, patients on the autism spectrum tend to have these problems, these DGBIs more often. And patients with PTSD, like you mentioned, but in general, patients who have had trauma in their history, difficult times in their childhood, will be more likely to have these disorders. So there's Jackie. I think you know more about this, right?
Yeah, we've seen studies on patients that have had sexual trauma.
Yeah.
And there's a correlation with obviously anxiety, PTSD, and as a result, a lot of unexplained digestive health symptoms, chronic diarrhea, constipation, bloating, all of those symptoms. But yes, you're right. We're not going to diagnose anybody. If you're having these symptoms and any of these scenarios sound like you or a loved one, it might be a really good idea. It probably is a good idea to go see your healthcare provider so that you can rule out anything underlying structurally or with a, maybe explain the difference. Sometimes with an IBS, there's no test. Okay, you have IBS.
Yeah.
They rule out other things that could be wrong structurally or a disease. Like a lot of times for women, ovarian cancer can present with a lot of digestive bloating and things like that. So you want to rule out that and not just assume you have IBS,
100%.
For instance.
We don't want to go around self-diagnosing.
No.
Because there are some nasty things that can present as GI problems, and to someone who doesn't know how to do the proper tests and things like that, can look like IBS. If you do some IBS Googling, you could I've got IBS, but maybe not. It's worth your time to go and get it checked out and make sure it's not some of the nastier stuff out there.
Yeah, but for those who have been diagnosed with IBS or another condition that's related to the gut-brain interaction, this would be a great workshop. I'm going to join myself because can never have too much information to help with your symptoms. Anything else, like for providers who may be listening, how can they explain this to their patients and suggest that this would be a good idea for them?
Yeah, I think it's kind of like if you're interested in a movie, go like just watch some of the previews, right? You're going to get some of the best scenes right off the bat. And like my rule for watching a comedy, for example, if I watch the preview and I don't laugh once during the preview, this comedy is not for me. Like I'm not watching that movie, right? Similar, like it's a kind of a way to get the preview of, okay, is this type of treatment, is this something that could help me? Even if just doing the workshop doesn't take you all the way there where you want to go, let's say it gets you 10%, 15, 20, 50%. But now you're like, oh, this really works for me. And now you can dive deeper. You could potentially do that one-on-one treatment. So as a provider, I would say patients that are a little hesitant, they're not quite sure they want to commit. This is like watching that preview to the movie. And you're like, oh, is this going to be a movie that's for me?
Well, and unfortunately, I think we've made strides in kind of hopefully reducing the stigma around mental health and therapy and what that is. I think, COVID did help accelerate our attention on mental health because a lot of us were struggling with, the isolation, our change to our routines, our not being able to go to the gym, and sought out a lot of the online channels for, talking with someone. So I think, if a patient, and I can speak from a patient, maybe like, oh, I don't need therapy for my gut. Let's talk about the difference between a workshop. And like I said, it's sort of like an appetizer so that you have an understanding of what to expect with a gut brain therapist. So can you explain like the difference between a workshop and gut brain therapy?
Right. And so I would say, like we also want to differentiate just in general gut brain therapy from, let's say, a traditional therapy where we're kind of diving in to somebody's past or their deeper issues. We're about teaching tools and teaching people ways to kind of shift their mind, their brain gut, to shift their symptoms, right? It's very result focused. And a workshop is even more so. We're even more getting into like, okay, let's teach it. Let's make sure you get the idea, the conceptual understanding. Let's make sure you get the tool that you can play around with, that you can practice. And it's not therapy. You're not diving in. We're not talking about your childhood. It's more about learning. The workshop is more about learning the high impact things that we felt would make the most difference in the shortest amount of time to people.
I love this. So for those, we're winding down our questions, but who's going to be leading the workshops? Is it, tell us a little bit about your team.
Yeah. So I started 4 years ago, and my role in the practice, I've been in charge of training and then just getting the word out, right? All the therapists in the practice have been through what we call GI University, right? And it's a lot because we're taking already good therapists that are trained to, treat kind of the standard mental health disorders, and then spending like 4 to 6 months putting them through all this material, one-on-one supervision, consultation, to the point where I would consider them kind of, now they're up at that level of being some of the best in the world. And so those are the people that are going to be running the workshop. There's going to be this very high level, very specialized therapist running the workshop.
No, and this is important to note because as we've become more focused on gut health, there's been a proliferation of everyone is now a gut coach, a health coach, and digestive coach. So I wanted to stress this. I'm not slamming anyone's business. I'm here about the patients. These are credentialed healthcare providers in this space who have experience and knowledge of these gut brain therapies. They're not influencers. And it's important to note because oftentimes There's so much on social media, and it's confusing. Even for me, I'm like, do I need this product? Do I need this product? I'm like, oh my God, I can have my whole refrigerator filled with gut shakes. And sometimes it can do more harm than good. And we've done episodes on this. So we wouldn't be in partnership together if this wasn't credible and validated. We're in partnership with the ACG as their patient education partner. This is very serious, and we encourage those who may be interested to check out. We have it on the Gastro Girl webpage. We have links. We also have links to Dr. Navidi's site, GI Psychology, where you can read all about their expertise. The dates are flexible. We want to see what interest we have and where people's time is, and then we'll form groups. So there's no payment upfront, but for the 4 weeks, it is $199, and I think that's a super value for what we're offering. But there's no money due right now. We want to see the interest, and the groups will be forming. And if you go to the website, and we'll have that below. But I want to thank you so much. You have any final words for our listeners?
Oh, well, I enjoyed this conversation a lot. I think your passion for this really comes through. You're so genuine and, just focused on doing good for your listeners that it was an absolute pleasure for me. So I'm happy and excited to be partnering with Gastro Girl because you all have such a great reputation in the field.
Likewise, and this is going to be exciting, and we're so excited to offer this to our listeners, to patients, and we're going to do all we can to get the word out. So thank you so much. Look forward to the workshops.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.